So I've seen this from, from the same side many of you have, which is that it's ridiculously hard. I have been uninsured. I've been underinsured. I have a high deductible plan now. I pay almost $800 a month in premiums on a COBRA plan for the job that I just left. Come December, I don't know what I'm going to do.
Sure, it probably occurred to you that whatever role you were playing, that had the episode not occurred in the first place, or if it had been less serious, then the consequences of engaging the system might not have been as complex.
Then it's also a misconception to believe that uninsured people get the health care that they need. In fact, the National Institute of Medicine did a study that found that people who are uninsured get sicker, they die younger, and in fact they do not get care.
I did not know there was an emergency card for cancer patients. I had a cancer patient, and this is her second time around. She was given the runaround just like you were in there. And we went to Cook County. She was put on hold. They told her you have cancer. She was diagnosed. Come back 3 months later. She's like, I'm going to die in 3 months. But the kind lady told me there's an emergency card for cancer patients, for women only, for cervical and breast cancer. I'm like, God bless you. How come nobody told me? I went back to doctors in Cook County. They knew, but they didn't want to tell us. Because if they told us, it's out of their pockets.
We have a tendency, I think, to believe that the solution to the issues of the underserved will come from Springfield or Washington. And in fact, in order to have a definitive solution, that is true. However, it's also a misconception to believe that there's nothing we can do in the meantime.
Legislators have done little talks for us, and what they say is, if I get one telephone call from somebody that tells me an issue is important, I say, oh, it's one call. If I get 2 calls, I perk up a little bit. I'm like, 2 calls, this is an issue I might want to look at. If I get 5 calls on this, I'm having a town meeting.
Some of the people in DuPage County, when I say the term federally qualified health care center, they think it's a communist plot. And in reality, it's one of those programs that has survived from the war on poverty. And a community health center is a nonprofit organization run by a community-based board that is 51% or more patients at the center. So it's very grassroots. They provide primary care. Some of them provide specialty care. Ours provide limited specialty care and are expanding that. They can provide dental and mental health care, and they have several unique features. One is in DuPage County, the doctors have not been eager to serve people with Medicaid for an assortment of reasons, and so folks had a card but not access to care. And so the community health centers receive enhanced rates from Medicaid and Medicare so they can operate with that funding source. They also have, as Richard mentioned, a special protection from the federal government for malpractice, so they don't have the huge malpractice expense. In some areas, doctors that work at community health centers can get their medical school loans repaid. There's all kinds of wonderful, magical incentives here. Then they also are able to purchase drugs at very low prices.
80% of the deaths in the United States are from chronic illness. We don't think of public health, though, when we think of chronic illness, and we should, because most public health people have called on us to remember what we did with infectious illness at the beginning of the century.
I agree that we need a national solution. And what we've heard is that in Canada, before they had their national health insurance program, that each province kind of started setting up their own program, and that motivated the national government to come up with one. That is our plan for the U.S.
But as residents, I would expect you to know this much because we're a little bit better.
There is a doctor. He's got Cornwall. Really does his entire practice of home care in DuPage County. Wow. He's got like a couple thousand employees.
Does he have a big van set up with medicine?
It's basically travels. I think it's a Ford Explorer now, and his medical assistant does the drive, and he's got his laptop.